So welcome everyone. My name is Tavia, and before we begin, I wanted to just let you know if there are any questions you have as we go along through our presentation here. Feel free to write them in the Q&A box that's at the bottom of your screen. Dr. Sierra, myself, and anyone else on the panel here will be answering questions at the end of our talk here. So thanks for joining us. We're very excited. This is our inaugural webinar event. And as most of you probably know, we launched the clinic a few weeks ago on International Women's Day. Evolve is the first egg freezing clinic here in Canada that's solely designated to be an egg freezing clinic. Tonight we have our founder and CEO, Nicole Condon, with us. We have Dr. Soni Sierra, who is the medical director here at Evolve, and she will be doing the talk tonight. And then we have another reproductive endocrinologist, Dr. Cassandra Greenberg, with us, who is also at Evolve, along with myself. My name is Tavia McLaughlin, and I am the director of special projects at Evolve and handle the events as well as any of the other educational information that we take care of here at Evolve. So a little bit about Dr. Sierra. So she's been a reproductive endocrinologist since 2006. She is also an associate physician at the Women's College Hospital, where she specializes in polycystic ovarian syndrome and is an assistant professor of obstetrics and gynecology at the University of Toronto. Dr. Sierra is widely published in peer-reviewed journals and authored chapters in prestigious textbooks, as well as presented papers at the national and international conference level. We are very excited and fortunate to have her as our medical director here at Evolve. In addition to that, she also works at Trio Fertility Clinic in Toronto, is a board member and a co-chair at the Society of Obstetrics and Gynecologists of Toronto as well. So I will let her take it away. She will be talking a little bit about fertility and egg freezing. So go ahead, Dr. Sierra.
Okay, thank you for that intro, Tavia. I am super excited to be here at our inaugural webinar and kicking off this amazing egg freezing clinic, which we hope is going to empower, educate, and provide options to so many women for now and for the future. So I'm just going to give you a brief overview, and then Tavia will go over some of the sort of admin and nuts and bolts of the program, and then hopefully we'll open it up and have some questions as well. So we'll start on the next slide. So what exactly is egg freezing? A lot of people have questions about it. There's a lot of talk about it, but what does it involve? So it involves essentially taking eggs from your ovaries where they are lying dormant in little pools of fluids called follicles. And we stimulate these eggs, we bring them to a certain degree of maturity, we extract them, and then we freeze them with a special freezing technique called vitrification, which can then store them sort of without an expiry date for use whenever you're ready. So in essence, it captures the quality of the egg at the age of the time it's collected. So it sort of freezes the aging process and it can be stored forever. So for instance, if you do an egg freezing cycle when you're 27 and you use your eggs when you're 40, the quality of those eggs will be as if they were still 27. Next slide. So why would someone freeze? So first of all, we recognize that when we're in our 20s or early 30s, it is actually the best time to freeze. So it's an important consideration in that time frame. And it's important because that's the stage at which your ovarian reserve is at the highest. And if you do have known fertility challenges or medical conditions or gynecologic conditions that are going to affect your long-term fertility plan, it's a nice idea to have a backup plan with eggs frozen from when you're younger. And it allows you to use your own eggs, again, preserved at the stage or age at which they're collected, to achieve a future pregnancy when the timing is right for you and your family, or you alone. And therefore, if you're not ready for parenthood during this time frame when our chances to conceive are the highest and our fertility potential is the highest, egg freezing gives you the option to use them when you're ready for parenthood, therefore preserving your freedom in allowing you the flexibility to make that decision when you're ready. Next slide. Next slide. So I spoke a bit about egg quality and quantity, just to review with you a little bit of the biology. So the day that we're born with ovaries, we have about 1 to 2 million eggs. And that's the most you're ever going to have. And as time goes on, that decreases even in the very early stage of infanthood. And by the time we hit puberty, which is essentially the turn on time for that biological clock, we're already down to 300,000 viable eggs. And that's why we say that women are their most fertile in their late teens and early 20s, just because of the number of eggs and what happens biologically moving forward from there. And it's not necessarily the count that changes as we age, but it's various factors that affect essentially the genetic function of that egg, which makes it more difficult to fertilize and then continue on to a healthy pregnancy and deliver a healthy term baby. It's sort of the machinery that allows the genetics inside the egg and then the fertilized egg multiply, divide millions of times to make a healthy baby. That process is what ages and gives rise to a lot of fertility problems, as well as early pregnancy loss as we age. So success rates pretty much stay the same between 25 and 35. We don't see any impact of aging, late 20s and early 30s. And therefore it's a good time to consider. And the other thing to consider is we don't necessarily have eyes on what's going to happen in the future for a lot of people. As you know, infertility can be quite common, and 1 in 6 couples will go on to experience infertility due to various reasons. And therefore, egg quality and quantity changes that come on with age could almost present almost like a double whammy situation. So as we get older, if there are other factors that lead to infertility, age itself are going to make those other factors sort of almost more significant when trying to plan for a family. Next slide, please. So this is just a sort of graphic image of, again, what happens to female egg quality with age and female egg count with age. So as I mentioned, the best quality of eggs we see in our early 20s. And then over time, things change. We talk a lot about the age of 35 as being what we call a later age in terms of fertility. But it's important to understand that it's not that you hit 35 and it's a wall, and then after that, your fertility declines. It's a very gradual decline. So 35 is by no means a cutoff to consider things like egg freezing or fertility preservation, but we go forward over the age of 35, knowing that our chances are a little bit lower, but definitely not zero by any means. Next slide. So again, what are the reasons to freeze? What are the reasons that we see women and patients coming to our clinic to talk about freezing? First and foremost, it buys people a lot of time to find the right partner so that we're not making life decisions based on biological needs only. Kind of is empowering to think that you can take your fertility in your own hands and make that decision to partner or not partner when the time and person is right for you. Endometriosis is a gynecologic condition that's quite common. We estimate that about 20% of patients have endometriosis. And it's important to note that this is a progressive condition. So as endometriosis progresses, just like age, it could become more significant in terms of the impact it has on the quality of the eggs. And it can also impact the quantity in that if it becomes severe, presenting with cysts or scar tissues that could definitely or directly impact the ovary. Sort of in line with timing, egg freezing also gives us time to pursue educational career goals or other personal goals that you want to do in that same time frame. as opposed to having a baby and starting a family. Part of your consult, and I'll get into that in a minute, part of your first meeting at Evolve Egg Clinic is getting your history, not just your own history in terms of your background, gynecologic and medical presentation, but also your family history. So as much as you know in terms of female members of your family, and since when did your mother go into menopause, and when did your grandmother, if you know that information, it'll help decide what your fertility history or trajectory might be. And therefore, if you do know that you had a family history of early menopause, egg freezing might be a consideration or a thought for you. There are other chronic or genetic conditions that can age the ovaries prematurely, certain autoimmune concerns, and then of course medical reasons. So if there is chemotherapy or immunotherapy coming up that we know could directly damage the ovaries, egg freezing is a really nice option to sort of preserve your biological options for a baby. We also see patients and couples considering gender transition. And again, freezing eggs prior to removal or taking hormones, again, keeps that option open for a family in the future with a biological child. Next slide. So what are the statistics beyond the average age or ideal age to freeze your eggs? Well, we know that per frozen egg that is stored, there's a 2 to 12% chance that that egg is going to result in a live birth. It doesn't sound like a lot, but we try to get a good number of eggs per cycle. So our goal is between 9 to 12, but the closer we get to 20, the better we can predict a pregnancy from a cycle or a number of cycles. And when we do get that egg fertilized in the future with IVF technology, and we get to the stage of embryo transfer, there's about a 45 to 75% that's going to be a live birth for you. It's becoming very popular and sort of a viable option for a lot of women. We know that in North America, there's over 5,000 live births from frozen eggs since 2015. So quite impressive, and we definitely expect in the next 5 years to see that number get even higher. Tavia is going to get into sort of the nuts and bolts and the costs in the next section. So I'll take the next slide, please. So just to give you a brief overview, what's the process? When you contact Evolve Egg Freezing Clinic, the first thing that will be done is you'll have a booking or an appointment scheduled with a fertility nurse specialist to review your history, reviewing important things, as I mentioned before, and then ordering tests. You're going to have a fertility assessment, essentially, and therefore there'll be blood tests to detect hormone levels, looking at those hormones I mentioned that stimulate your ovaries naturally to make and mature an egg. We'll look at that with blood tests. We'll look at a specific hormone called anti-Mullerian hormone level, which reflects how many follicles are sitting there dormant in your eggs. Again, it's another test that gives us an idea about egg quantity. We'll do a transvaginal ultrasound to look at the volume of the ovaries, and again, something we call an antral follicle count. And then if needed, depending on your history, a physical exam will be scheduled. With all that information in hand from your history and the test, you'll have an appointment with an infertility specialist or fertility specialist, and you'll have a personalized discussion about your specific results and leave hopefully with an understanding of where your fertility is at now and what options you have to preserve for future fertility. You could have a personalized egg freezing plan developed that again is not based on any particular formula, but based on your specific results, and then a discussion about timeline and next steps. Next slide, please. So what's the process? So this will be reviewed in detail, again, one-on-one with your physician, and then following up with a lot of support from your nursing team at Evolve. But briefly, the process involves stimulation. So you'll be taking fertility medications that are manufactured to mimic natural hormones that stimulate your ovaries. So these hormones encourage your follicles to grow, and we monitor your response with blood work and ultrasound to make sure you're not having an over response or an under response. With the medications, we also prevent ovulation from happening before we go in to collect the eggs. And then you'll have a final injection when your stimulation is complete that triggers your release, but we don't wait for that release. We use that injection to give the eggs their final kick at that maturation process before we go in, retrieve them prior to the ovulation, and then go on to freeze them. So the actual egg collection procedure is done in-house at Evolve Egg Freezing Clinic. It's done under conscious sedation, so you're awake, but you're very, very relaxed. And the medication, as well as some local freezing, is designed to take away sharp pain from the procedure. Typically, you'll be a little groggy the day of the procedure, but the next morning you should feel much better. Most people are up and around normal activities the next day. And on the rare occasion, it might take a couple of days to get back to normal. Next slide, please. So a lot of people do have questions about risks of medication, and you will be getting sort of a visual video as well as a lot of discussion with your nurses and your team at Evolve. But the risks that we see commonly are mostly related to the fertility medications. So we worry about ovarian hyperstimulation syndrome. It can happen maybe 1 in 200 cases where you take medications and your ovaries make too many follicles. And that could lead to your ovaries being very swollen. You could feel them. You might be bloated, nauseous, abdominal discomfort. But again, very rare. And we usually see it coming. And so if we can see it coming, we adjust your stimulation protocol as you're coming in for monitoring to prevent you from actually getting sick with something like hyperstimulation. The actual egg retrieval process is fairly straightforward. It is a surgical process. It's done under, like I said, anesthetic. And so there could be risks related to that, but the rate is very, very low. So probably less than 1 in 5,000 if I had to estimate. And then there are emotional considerations. So this is a very important part, and it's part of the reason we started Evolve Egg Freezing Clinic. So thinking about your fertility, your family plans for the future is often an emotionally charged consideration. And coming through and going through a regular fertility clinic where there's other couples there who are going through fertility, it could be triggering for some patients. So Evolve is aiming to give you a very safe space to consider your options, as well as a very supportive team from admin to nurses to your physicians. We will all be there for you as you go through this important decision. And then if needed, we do have resources outside of our clinic, such as a therapist with some specialty and interest in helping women through these decisions and process. And I believe that's the end of my slides, and I'm going to hand the mic back to Tavia, who will walk you through more of the steps.
Thank you. So I will get into a little bit more about Evolve and some costs, and then we'll take some questions. I see there are some questions in the Q&A, so thank you for posing those questions. So is egg freezing right for you? It's obviously a very personal decision and not one to be taken lightly. Everyone is unique, and as such should take the decision very seriously themselves. The first thing really to talk about is what can you influence? And at any stage in your life, obviously, this is something we're all always thinking of. So the costs, you can influence the costs with respect to egg freezing, whether it be getting a GP referral to come in and have some tests covered, bundling services. Some insurance companies and insurance plans, it's becoming more and more common for fertility treatments or at the least fertility drugs to be covered up to a certain amount. All of these things are things you can look into ahead of time. They're also things that we work with companies on here at Evolve. We're really trying to advocate for our patients, and there's been a lot of news lately about patients and employees requesting fertility treatments that large companies are taking into consideration and putting into effect. As well, there are tax credits from the Canadian government that you can really look into to help make your decision. As Dr. Sierra spoke about timing, you can influence the timing. So there's a best age range to freeze, and knowing your options and knowing your fertility as it stands right now really gives you the power to make the best choice for you. You have the option to choose many clinics. So there are many clinics in Ontario within the GTA that do egg freezing, but it's a matter of what's the best fit for you. And a lot of people speak about the ability to book appointments that fit within their schedule, the ability to go somewhere close to their work or home, having a staff that understands what you're going through, or being able to specialize in egg freezing or different processes that are unique to your situation. And then Dr. Sierra spoke a little bit about this, but the ambiance of clinics. So something that really struck a chord with our founder when she was looking into this. With so many egg freezing patients have spoken out in the past about not wanting to be a number and feeling as though maybe they didn't belong in a traditional fertility clinic because it's very stressful, it's very overwhelming, and quite frankly, you are a different type of patient than a patient who is struggling trying to get pregnant and wanting to start a family right now. And so looking into that when you are choosing your egg freezing clinic and what's best for you is definitely something you shouldn't take lightly. And then food choices. So while you don't need to limit your diet or cut out caffeine and alcohol when you're undergoing egg freezing, it is important to know what food choices will optimize your fertility and your follicle count. So these are all things that you can really influence when you're choosing your fertility clinic to maximize your results. Now, the steps and the costs. So the initial consultation with our nurse, there's no charge with that. That is something that we offer at Evolve right before we move into the fertility assessment and testing. And the fertility assessment and testing is covered as long as you have a referral from a GP, or we do work with some virtual clinics where you can get a referral so that you're testing other than your AMH testing, which is $108. The rest of your blood work and testing is covered with under your OHIP. And we really want to have these kind of two steps as painless, as seamless, and as lowest cost as possible, because we believe everyone should know where their fertility is, whether you're wanting to freeze your eggs now, whether you're wanting to freeze your eggs down the road or not. Having a great understanding of where your fertility sits right now really is empowering. And as a young, successful woman, this is how we want you to feel. And we want you to be in control, and we want you to feel supported along the whole way. From there, you can schedule a follow-up appointment with the reproductive endocrinologist, and they'll go through what Dr. Sierra was talking about. They will talk about your results and what they mean, and then go into to the other steps. So whether you want to begin your egg freezing process right away, whether you just wanted to see where you are right now as a snapshot in time, whether it's something that you feel you need to speak more about with a naturopath. We do have naturopaths that we work with here at Evolve. As well, we have therapists. It's a very emotionally charged decision for some people, and we don't take that lightly. So we do partner with therapists as well. And these are all things that might go into your considerations along the way. It isn't a straight path by any means. So we're kind of a one-stop shop. You don't need to go anywhere, but you definitely don't need to make decisions by just coming in with your initial consult. You by no means are making the decision to freeze your eggs. An egg freezing cycle, one cycle costs $8,600. In addition to that are the fertility medications. So fertility medications range depending on your individualized plan, and they range from $3,000 to $5,000. And then an annual storage fee beyond the first year is on top of that. So the fertility medications and the egg freezing cycles, these are all things I spoke about before that some people have coverage for, and some people don't. So a little bit more about Evolve. We're the first and only clinic in Canada dedicated to only egg freezing. And so why is this important? Well, we really believe that the egg freezing patient is going through a very different life experience than the traditional fertility patient. And as I mentioned before, as a young, successful woman, we really want you to feel empowered by this. And a traditional fertility patient has usually struggled with trying to get pregnant for over a year, or often well over a year. And they really want to start a family right now, and they're in a very different mindset. So we don't want that emotional baggage and stress that linger in many fertility clinic waiting rooms. We don't want that to be a part of your journey. So our relaxed hotel-like atmosphere is really designed to make you feel that way, to feel more relaxed. Our expert team of reproductive endocrinologists, nurses, naturopaths, therapists, and business leaders. And then the one I really want to go back to there is embryologists. So embryologists, those are the people who work in the lab actually freezing your eggs. And why this is important is because our lab's director did the first successful egg freezing in Canada and has more egg freezing experience than anyone else in Canada. So we're actually the sister clinic with the largest fertility clinic in Canada. So we have over 40 years of lab experience. Egg freezing is not new to us, and we're real forerunners in research and development in this category. Within our sister company alone, we've done over 500 egg freezing cycles. And if you add to that the number of IVF cycles and embryo freezing that the clinic has done, it quickly reaches into the tens of thousands. Eggs are not as easy to freeze as embryos, and you really need someone who's experienced. The vitrification process is unique, and we have the best. We have a free consultation with Evolve, which I think I've spoke about a few times, and we're backed by over 40 years of clinical experience. So the next steps, we are happy to offer everyone an educational consult with our nurse, which is free of charge. And then from there, if you would like to book a fertility assessment and do some testing, that is all something that you can speak with our fertility nurse specialist at the time of your free consult. I wanted to put up here a bunch of resources, and I'll just leave them up on screen here for a moment before we head into the Q&A. So these are all non-Evolve branded sites that we find really helpful. Some of them have been pointed out to us from some of our egg freezing patients. They have followed some of these podcasts for a while, or in terms of website, they're the person who runs the Experience website. That is someone who themselves went through the egg freezing process a few times and then has dedicated a blog to it. So I just want to put these up here. If you want to jot them down or screenshot what we have here, we'd love to share our resources. If you haven't noticed from Evolve, we're very passionate about egg freezing, with the main thing being we want you to be empowered. And empowerment comes from education and knowing where you stand. No two people are alike, no two eggs are alike. And so please, do your research in order to give yourself the best option. So with that, I will move over into the Q&A. There are some already posted. So I have some for you, Dr. Sierra. So does OHS, ovarian hyperstimulation syndrome, affect future fertility?
Okay, so that's a good question. So as far as we know, it doesn't. Ovarian hyperstimulation syndrome is a temporary reaction to your ovaries stimulating a lot of follicles. And what happens is the cells that mature and support eggs, if they're hyperstimulated, can also secrete extra fluid. So as long as the hormones are circulating, they react to the hormones by secreting extra fluid and giving all those symptoms. However, when a couple of weeks go by, and especially once you get a period after the egg freezing process, the ovaries get very quiet, the stimulation stops, your estrogen drops to a normal level, and you start to cycle again. And there doesn't seem to be any impact of your future fertility from having gotten ovarian hyperstimulation. It does sometimes affect egg quality in that cycle, so it is something that we don't we don't want to have. We try our very best to avoid it. And as I mentioned before, it is quite rare. So hopefully that answers your question.
Okay, thank you. The next one is, what is the time commitment involved in the egg freezing process?
So the time commitment outside of the initial appointments, you could have possibly at least 2 appointments with your doctor prior to doing the procedure. So outside of those initial appointments, when you actually come in and start the process, there are probably 4 to 5 appointments early in the morning where you come in for assessment to begin, as well as stimulation to be monitored for your response. And then there's the procedure day, and then there's the follow-up appointment with your physician. So in total, there's probably about, let's ballpark, around 10 appointments that you'll be in for. And outside of the initial consults, the rest usually take place over a 2-week period, 2 to 3 week period.
Okay, great. I think that answered that one. Is egg retrieval possible to do with an IUD in place?
So yes, especially if you have a copper IUD that's not providing any hormones, the IUD doesn't interfere with any of the testing, assessments, treatment, or procedures. It definitely can be done with it in place. When you meet with your physician, if you have a hormonal IUD in place, after your initial assessment, which you can do with it in place, you'll have a conversation on whether it's recommended it stays in situ, or if other testing might need to be done with it removed, etc. But for the most part, we're working on your ovaries and nothing to do with your uterus.
Do you start the study, do you start the injections at a natural cycle, or do you ask the patients to be on estrogen meds to create a planned cycle at Evolve?
So it depends on your specific fertility results. There will be cases where we'll have to start on the 3rd day of a cycle, either medical reasons or ovarian reserve reasons, or sometimes depending on travel plans, etc. But our goal is to give a little bit of downregulation, and it's not always related to just being able to plan out your cycle, but we like to give a little bit of birth control pill or some kind of estrogen treatment for a few weeks prior to starting, because what it does is it very, very gently downregulates your ovaries so that all of the follicles are at the same stage, so that when we start the stimulation, we'll get a nice response and a good cohort all growing together. So most often there's a couple of weeks of pre-treatment, but again, not every single case, and we do make that decision considering all the information we have.
Great. And so this is you answered this a little bit here, Dr. Sierra, but if someone is currently on the pill, how long before would they need to come off, and would you start the cycle? And actually, because I've heard this one before, if maybe you also want to tie in with this, can people have sex during their during this process or during this cycle?
Okay. So 2 questions there. So one with the pill. So we can do a lot of your assessments without asking you to stop the pill. And again, depending on the results, if they look great and your ovarian reserve testing is perfectly normal while you're on the pill, you don't necessarily have to stop it until we start the stimulation. However, if your tests come back as not ideal, or there's other concerns, sometimes we'll ask you to stop the pill for a couple of months and then repeat and go from there. But because the pill is part of treatment, we can often work with your own pill schedule to schedule when treatment starts. And so it doesn't necessarily have to be stopped prior to. So hopefully that answers that question. And then the other question about having sex during the stimulation, we often advise not to, because you won't be on contraception during the stimulation. You won't be on any hormonal contraception. I suppose you'll still have IUD if that's the option you use. But for the most part, as your ovaries get stimulated, they'll be large and you will feel a little bit uncomfortable. So most people don't want to because of that reason. And then the other reason, if you're not on an IUD and you are sexually active, you're going to have a lot of eggs. And even though we try to remove them all at egg collection, there could be one or many left behind, and you'd be at very, very high risk of pregnancy with multiples. So we typically advise no sex or using some kind of barrier contraception if you're going to be sexually active during your egg freezing month.
The next one I will handle. So the question is, which insurance companies do you currently know that support or cover fertility treatments? So this is a growing number, but it's more tied into, so all of the large insurance companies do have different plans with your company that you work for. And so all of your benefits are kind of dictated at the top from the company that you work for. Some big news in the banking world a couple of months ago was that TD Bank just implemented a huge amount towards fertility treatments. I believe it was $30,000. And I know TELUS and Bell both have up to $15,000 of fertility treatment coverage. But then different plans have different amounts. Most plans we're seeing these days cover up to a certain amount of fertility drugs. So really what I suggest you do is talk to someone in HR about your benefits for twofold. One, they can tell you if it's covered, and two, they can let you know the company that does cover your benefits. Or you can go into your, those big, thick, boring benefit manuals you get when you sign on with a company. You can go through and everything is stated in there that is covered. But I'm happy to walk through this with you, or if you feel this would be of benefit to your companies, please just send me an email. My email is actually now up on the screen. And we've been working with a lot of different companies, as companies right now are really having a hard time finding employees and keeping employees. And so a lot of them are adding these one-off type of coverages to their plans. They're adding things that employees really want. So if you work at a company where there's a lot of people in the same demographic as yourself, they might be thinking the same thing. So feel free to reach out. I'm happy to talk to your benefit provider on your behalf and find out exactly where that lies. Sorry. Some more questions here, and I'm not sure if Sony or if Nicole wants to cover this, but there's the question about if you're under the age of 43 when you decide to come back and use your frozen eggs after not being able to get pregnant naturally, can they be used as part of the government's IVF cycle coverage, the OHIP covered IVF?
So I actually don't know the answer to that question. So
I wonder if Nicole might be trying to weigh in here.
Yes. Yeah, so the government funding program will cover the frozen eggs as your IVF cycle. So it would be done essentially for free, the fertilization and the transfer of all embryos created from that frozen cycle.
Okay, great, thank you. Someone's asking about how much IVF will cost if you want to use the eggs. So it's about the same amount as freezing your eggs. Freezing your eggs is essentially about the same cost as kind of half an IVF cycle. And so going through the second half of the process, you're saving about 50%. So an IVF cycle currently right now is upwards of $12,000. And so you're not going to be paying that full amount because you're not going to be going through the egg retrieval portion of it. Is that correct as well, Nicole?
Yep, that's correct.
Do the shots cause PMS type symptoms? Sony?
So the shots themselves don't cause PMS type symptoms. Some people do report very minimum, but some people do report headache, mood changes, hot flashes, but like I said, very rare. When you might get PMS symptoms is sort of after the IVF procedure, when you're waiting for your period. You'll have PMS as you naturally would in between ovulation and getting your period. And because you have been on a lot of stimulation and your ovaries are so big and active, you might have a little bit of a more stronger PMS, but just that one cycle. And like I said, once you get your period, you're back down to sort of normal baseline moving forward.
All right, there is a few more here. Oops, sorry, are you all right? Oh, can you read it?
Yeah, I'm done.
Yeah, so do my frozen eggs get stored at Evolved in-house, or will it be stored at Trio? What happens when I'm ready to use them, thaw them for embryos? So
I'll do that one too.
Okay.
So they'll be stored at Evolve in the lab there. And then when you're, if you ever do need to use them, then we'll just ship them upstairs, frozen upstairs, and they'll be ready to use whenever you want them. But we'll keep them at Evolve just because we have designed the space to allow for the tanks for the storage on site there.
And then it looks like the last question for right now anyways, if I'm not ready to get pregnant until I'm 44 or older, will I still be able to go through IVF with my frozen eggs? And what are the risks of this?
So yes, you'll be able to use your frozen eggs, and they should give you a pregnancy, a chance at pregnancy. Like we mentioned, a very high chance between 45 and 50% or higher. Whereas if you were to try to go through IVF at 44, your chances would be maybe 2% in the best case scenario, or they can be as low as 2%. So it is definitely a good option. Having a baby over 40 comes with risks, obstetric risks mostly. So risks of early delivery, risk of operative delivery, as well as increased risk of blood pressure problems, sugar problems during pregnancy. But in making the decision to get pregnant over 40, of course, you'll have a consultation with your fertility doctor, potentially an obstetrician, make sure it's safe to proceed. But it is definitely an option as you get older, over age 40, to use your frozen eggs.
And then Nicole, probably a little bit of a question for you, a little bit of a logistical question. What mitigation efforts do you have in place to ensure there aren't issues with women getting the wrong eggs when they're ready to use them? Not that this occurs often, but it's been seen in the news.
Yes. So we have something called Gidget. It's a witnessing procedure barcode thing in the lab. I'm not sure, I'm not describing it very well, but when you have your egg retrieval, all your dishes, all the things are retrieved and put in dishes have a barcode on them, and they're scanned to make sure that the barcode matches the person that's in the room. And if there's a mix up, an alarm will go. And then the same barcode is on all these straws where the eggs are stored. So with this new witnessing system, there weren't witnessing systems many years ago, and some smaller clinics still won't have witnessing systems. But with these witnessing systems these days, it'd be pretty much impossible to mix up eggs because alarm bells will go off in the lab, and it's a pretty scary sound. So it doesn't happen in bigger clinics now with that technology.
Okay, thank you. Another question for Dr. Sierra. If I want to get my thyroid tested or to get tested for Hashimoto's, PCO, or endometriosis, is that something that Evolve does?
So in addition to your basic fertility tests, when you meet your Evolve physician and they're reviewing your history, if you're at risk of any of those conditions, then yes, because they are related to fertility, we will order the tests to sort of look at that as well and have a discussion and make appropriate referrals if need be.
Great. A question, these might actually be made, there's two questions, they might be kind of correlated, but in terms of going through an egg freezing cycle and x-rays, I believe this is what it's related to. Can I get x-rays before egg freezing or while an egg freezing cycle is the first point.
So yes, there's no harm to getting x-rays when you're prepping for an egg freezing cycle or going through the stimulation.
And then the second is about fluoride. Can you get fluoride while going through an egg freezing cycle?
Yes, same thing. Getting fluoride at a dental appointment isn't going to change your ovarian response or cross-react with any of the meds as far as we know.
Okay. And then the last one that I have is, can I come in just to do a fertility check at Evolve, even if I don't really think I want to go through egg freezing, but can I just find out where I am today?
So I would say yes, 100%. We will see you and provide that information. It's part of the process of getting educated and empowered if you need to use that information to either be aware of your fertility or make a decision. So it is definitely part of what we do at Evolve.
Oh, another one popped up. What's the, this is a great one actually. What is the average number of eggs that are retrieved per procedure? This question specifically is talking about women that are 38 or 39 years old. I don't know, I know we didn't actually really speak on the graphs that are out there that talk about kind of different amounts for different age groups. Can you speak about that?
So there isn't sort of a, like I said, there's no set prediction to say how many eggs anyone's going to get based on their age. We just know that we get the most when you're 25 to 36. And then as we age beyond that, the number we're going to get is lower. I think there is something like a sweet spot when we talk about freezing eggs. It's probably between 16 and 20. I think when we get older than 35, while some women, especially when their fertility tests are excellent and they're otherwise healthy, they could very well get that in one cycle. But sometimes as women get over 35, closer to 40, we still might get that number of eggs, but we might have to do it in 2 cycles. So it's hard to predict, but a lot of it depends on what your fertility testing ends up coming back with.
And what percentage of follicles initially seen on the ultrasound usually turn into ones that get retrieved or into a mature egg?
So it's hard to say exactly. I think that we use the antral follicle count as well as your AMH together to predict. Normal healthy antral follicle count is about 7 in each ovary, so that's 14 across 2 ovaries. And if we think of it that way, we get 9 to 12 mature eggs in somebody in that age range. So I don't know, my math isn't that great, but I'd say whatever 9 out of 14 or 10 out of 14 is. But I would think it can be between 70 and 80% of the eggs we retrieve will be mature.
And the final one that I have here right now, actually I can answer. So it's about the average cost of egg storage. So in the $8,600 for the egg fertility retrieval, we do include 1 year of storage. And then we have different storage plans. So in general, the storage oh my goodness, I just did the storage plan. So in general, the storage per year is $500, but we do have kind of a 5-year plan where you get one of the years for free. I believe it's a $2,000. And there's different packages depending on when people think they're going to be using their eggs. So that looks like it wraps up the end of our questions. Thank you so much, Dr. Sierra, for answering them. Thank you so much, all of you, for posing them, some great questions. And thank you for attending our first session here. I will be reaching out by the email you have provided, and just as a thank you, and if you just to provide you with my email, and for anyone who's looking to book that free nurse consult, you can do so at that time when I reach out, or feel free to go on to our website, evolveeggfreeze.com, to book your initial consult based on being at this webinar. So thank you for attending. Thank you for your amazing questions. I'll be sure to include a lot of those in the next time we do this presentation. So that is all we have for you for tonight. Have a great evening, and we hope to see you again.
Thank you. Thanks, Tavia.